So, I've been working as a neurologist now for more than a decade. I've been really passionate about Alzheimer's prevention because of my personal and family history. I started Alzheimer's prevention program primarily for self-improvement. Because of my family history, a few years ago I decided that I don't want to have the same fate. So I started making some changes in my lifestyle. I learned a lot and then I realized I need to disseminate this information to my friends and family and caretakers of my patients. They commonly ask me, that doc, what can I do to reduce my chances of developing Alzheimer's disease?
A wellness coach is a lot of different things, actually. I'd say the most important thing a wellness coach does is hold people accountable, but we're also trained in things like motivational interviewing, where we can help guide behavior change. There's a lot of research saying that education alone does not cause somebody to change behavior. So for those that might not be quite as ready for change or as motivated to change, we are trained to help guide them and allow them to make smaller steps that they feel confident about to make the lifestyle changes that will help them. Like Dr. Shah had said, he's very clinical, he's got a lot of research, and together we can deliver that education based on research. Also, I can hold people accountable, stay in touch with them, and since there's so many pillars involved, there's fitness, there's nutrition, there's stress management, I'm able to help coach people more on an individual level as well, to help them with their specific goals that they need the most work on.
I'm so happy that Jill is helping me with this program because I have a lot of ideas about how and what people should do, but Jill brings in very practical aspect that how they actually change their life rather than just having a theoretical knowledge. So I'm really happy that Jill is part of our program.
Thank you. We make a good team.
Yes. Yes. Initially, we were not aware that there are ways we can prevent Alzheimer's disease. But now we have a lot of research evidence. It's not just one or two papers. It's not just one meta-analysis. There is a journal of Alzheimer's prevention since 2014. There is a Lancet Commission. It is one of the most premier European Commission on dementia prevention, which suggests that 40 to 45% of dementias are preventable.
That's a pretty easy answer. Everybody is a perfect candidate for this program. The only ones I see maybe being an exception are people that actually are in the disease at further stages along, only because it would be difficult for them to follow the instructions that we give. But otherwise, anybody that is interested in preventing cognitive decline can participate in this program.
Yeah, you're right. I feel like the classical patient would be somebody who is in their 40 to 60s. They're highly motivated. They want to do better. They want to not just take pills, and they want to make real life changes. Like if somebody already has significant cognitive impairment, I've seen that family members of that person participates in the program so they can implement those changes in the patient.
Absolutely.
I feel like the best part of running this program for me is to see the results. I fortunately have had patients who have graduated from this program and they have changed their lives. I specifically remember this one patient. When I started seeing her, she had a lot of health problems, and now she is doing really well. Her blood work has improved significantly. She used to live with her daughter. Now she's living by herself independently. She's highly involved in her church activities, and she's volunteering at places and has picked up painting. So seeing this result is what motivates me, that I'm on the right path and I need to keep going.